If I told you that some of the diagnoses are not really for saving lives, but silently uh, could be stealing them. Sometimes you may feel or hear a patient say that a patient wants a full body scan, and then you ask, is it really necessary? Take for example that a year-old lady who undergoes a full body scan. Swelling is found in her thyroid gland, and then this follows surgery, and then after the surgery she has difficulties with her voice, and then there is a follow-up of many things with the anxiety and the many unexpected things. So let's look at what is diagnosis. When someone presents and the clinical judgment. So the patient will give the doctor the history. Then from the history, the doctor will ask him or her the questions. And then from there, he will examine the patient, possibly order some laboratory tests and also possibly some radiology test. And then based on his test and his clinical acumen, he will make a diagnosis. So that is what diagnosis is. So what is misdiagnosis? Misdiagnosis means you have the wrong diagnosis. You did not get things right. So you have the wrong disease, and this will lead to the wrong treatment. Then when we talk about overdiagnosis, what are we talking about? It means correctly identifying a condition, but this possibly the condition you have identified will never cause harm in the patient at hand. And so the treatment could be more harmful to the patient than leaving it alone. Then you have overmedicalization, which this is turning normal life experiences into medical problems needing treatment. For example, you may have a patient going through the normal menopausal processes, not much bothered, but then you treat it like it's a disease and you put them on treatment, and this could cause more harm than good. So why does overdiagnosis happen? One, we have advanced screening technology, which finds incidental findings, things that you find because you did a test. They were not really the main issue, but since you did a test, you found them out. For example, you may do an ultrasound of the abdomen and you find some cyst in someone's kidney, or possibly a cyst in someone's liver. Then would you go ahead and remove the cyst because you have found them, or should you leave them untouched? Then sometimes defensive medicine, where there is fear of the doctor being sued. So the decision on what to do are based on fear rather than on the evidence that is available. Then pharmaceutical and commercial pressures. There is a lot of marketing of medical drugs and the medical devices, and sometimes you may base your decisions based on the pharmaceutical companies rather than on the needs of the patients at hand. Then we have lowering diagnostic thresholds. For example, the American Heart Association, they have lowered the threshold for the diagnosis and the management of hypertension, making the normal blood pressure, abnormal blood pressure, come to as low as 120/80 millimeters of mercury. So you find there is a group of people between the age of the ages of 120 to 140, and between 80 and 90, and many people will follow in that category. These could be just normal people, but because of our threshold of defining hypertension, then you find they are on treatment. Then the question is, are we doing these people justice by treating them, or the drug that you are giving them, could they put them on more harm than the good for the patient. Sometimes we also have seen the threshold of defining what is diabetes and what is pre-diabetes, and depending on where you put your threshold, then you have more patients who fall in the sick category. Then there's the fear culture, whereby we feel like if you have more tests, then it is better. But this creates situations of fear and unnecessary treatment, and sometimes even more investigations. So some studies have been shown in some countries. For example, there were some large-scale screening of thyroid cancer in South Korea, and many people were screened for the possibility of thyroid cancer, and many people were diagnosed to have thyroid swellings and thyroid nodules, which many of them were operated. But even after operating so huge number, remember when you are talking about treatment of diseases, there are two things that are very important. One is the reduction in death from the condition at hand, and then reduction in the presentation in the healthcare system because of the disease, of the complications of the disease at hand. So even with a lot of diagnosis and the treatment of thyroid cancer in these patients and in this country, there was no tangible change in the death or presentation to the healthcare system because of complications of thyroid cancer. So this was a case of overdiagnosis. Then you have prostate cancer, which we use a test which is called prostate-specific antigen. This test is used to detect cancer in men, and you find that prostate cancer is one of the cancers that sometimes it's very uncertain on its progression. There are people who will have it and it will progress very slowly, that they have other comorbidities, that most likely patients will get complications or die from other complications of other diseases rather than prostate cancer itself. But when you do community screens with PSA, you find many men with the elevated PSAs for various reasons. And then if you have elevated PSA, then you may need or be pushed to do a biopsy for these patients who might not have suffered any consequences from their prostate. And then the biopsy causes increased risk of infection, increased risk of bleeding from the prostate, causes more anxiety, and causes more use of the healthcare system. So there are also some consequences sometimes even in the management of breast cancer, whereby you find that sometimes because of the mammogram you find incidental lumps that could not have had any consequence, and you end up overdiagnosis and overtreating these patients. So it is an issue of balancing the good and the bad of what you are doing. So what are some of the consequences of overdiagnosis and overmedicalization? One is the psychological harm. Of course, when you tell someone, oh, your PSA is high, you likely have prostate cancer, then you cause anxiety. This causes stress, and this can be very inconveniencing to the patient. Then there is the physical harm. As I've said, if you find someone PSA is elevated, you may need to do prostate biopsy. The biopsy could lead to infection and then other side effect of surgery if you decide to operate to remove the cancer, leading to incontinence of urine and also sometimes erectile dysfunction. Of course, there is the financial implication to the patient and to the healthcare system, and sometimes the cost could be enormous. Then there is erosion of trust. Because of these practices, you find that patient might lose trust with the healthcare system, and then distracted care, whereby real illness is missed. Sometimes you may find something that in medical terms we talk about growth, and usually the term is used, like fibroadenoma. This is a swelling in the breast or in the uterus, and so this is things that you find incidentally. We call them incidentalomas, things that you just found. You were just doing an exam and you just found them, and so then this could distract you from looking for what is the real problem of this patient, rather than you pursuing something that is an issue. As I've said, for example, a patient presents with abdominal pain. You do an ultrasound. You find she has a few kidney cysts, small ones, less than 5 centimeters. You just found them. You are not looking for them, and most likely this could not be the cause of the abdominal pain that the patient had. But because you found them, they might over distract you and take your attention from the real issue. So why is this practice of overdiagnosis persisting? One is the medical culture of doing more, that there is availability of things. So we are a consumer society. Everything you want to use. So we have the capacity to do the test, let's use them. But remember also, some of these tests, like the CT scans, they also have their negative impact. So you cannot just expose patients to some of these tests. Then sometimes profit-driven systems, taking into account that healthcare is also a business. Sometimes if you do not think about the needs of the patient, then the profit part of it could drive your actions, which could be risky to the patient. Then patient demand for answers. Sometimes a patient comes, they have a myriad of complications. I have a headache. Why do I have a headache? I have some dizziness. Why do I have a dizziness? I have some chest pain. Why do I have chest pain? I have you need to have an answer for all these things. So, and this can be overwhelming to the healthcare providers, because usually in the diagnosis process, you want to look at what is the main things and what could explain most of the presentations, rather than going into the intricacies of the small things of each symptom that a patient have. Then media and health facts, what we lead. We have seen some things on social media. You would want them done on you. You have seen an advertisement. You want also to have it done on you. And so this drives your quest for the care. So as the healthcare providers, how do we overcome these challenges? One is educating the clinicians and the patient. The health providers need to know the sequential ways of doing things. You need also to be able to make a judgment when to wait, and when to leave it alone, and when to treat. Then shared decision making. In one of the previous videos I've done, I've talked about patient health provider partnership, whereby the patient is the one who is in control. So you discuss with the patient, see what are the risks, what are the benefits, and then you make the decision together based on very many things, and then you decide what is the best for the patient. Then choosing wisely, looking at all the possibilities, looking at all the evidence that is available. What is the most likely thing, and what would be the most beneficial thing without causing more harm to the patient. Then reformation in medical training, whereby we are more focused on prevention of diseases and keeping people healthy, more rather than more on treating diseases. Because as healthcare provider, we need to be healthy managers, not disease managers. Because people are individuals, and there are various aspects of needs. And remember, an individual is not part of, the disease is part of an individual, and it's just a small part. This person has many other aspects of his life which you need to take into consideration. Then regulation of the pharmaceutical influence, so that most of the studies and the decisions that are made by the health providers are not driven by the pharmaceutical industries. So what are some of the ways to ensure responsible diagnosis and avoid this over-medicalization? One is AI and the precision medicine, so that you have personalized and targeted care to individuals. Then value-based care, where you focus on the health outcomes, whereby you can be able to assess this intervention. Does it improve on the morbidity? Does it improve on the mortality? So like, for example, if you screen for breast cancer, are you likely to reduce death caused by breast cancer? And obviously from public health studies, it has been shown that screening for breast cancer is life-saving. Screening for cervical cancer is life-saving. And that's why it is being encouraged that patients should go for breast cancer screening, cervical cancer screening. Other cancers like prostate is they are still in a gray area, especially using the PSA, and possibly in one of the, I've talked about prostate cancer before, but we'll have a urologist also share his light about screening of prostate cancer, and what would be the best way forward. Then community health, whereby health is not an individual aspect, is embracing healthy lifestyles, and which this is impacted by many things from policies, medicines availability, and what are the relevant medicines, and what should be within our jurisdiction, so that we know the essential medicine that should be have available, and avoiding unnecessary over-medicalization. Then transparency, measure and expose over-diagnosis. We need to realize that over-diagnosis and over-medicalization is a reality, and we need to come out with ways of overcoming it and getting back on track. So to the clinicians, to avoid and protect the healthy from unnecessary harm, let's think twice and test wisely. Before you order a test, you need to know what do you expect from the test, so that you don't take anything that you find from a test and take it. And remember also that when you order a test, it will be advised that you do the other test. But as a health provider, it is within your mandate to know what is going to lead you to the diagnosis that you are thinking about. Then to the policy makers, finding value and not volume in the policies that we make, and also think about the community health welfare. And then for patients, it's important that you ask critical questions and what is necessary. Do not just ask for services because you have the capacity to pay for them, but what is necessary for you. So let's shift from sick care to wise care, where people get the care they need, but not what is available. So the art of medicine is not doing more, but it is knowing when to stop. And this could avoid harm when it could occur because of overdoing some of these tests, and also giving some of these treatments, which we should try as much as possible to avoid. So thank you very much for being in this live. I encourage that we share our questions, our concerns, what have been our experiences. Have we been overdiagnosed? Have we heard of situations where there has been overdiagnosis? And some of these, how have they impacted patients' lives? Questions that may come from the audience, or comments. It would be good that we have questions of some of the implications of this overdiagnosis. Questions that So any questions that could be coming from the audience? In the absence of any question, then it is important that we realize that over diagnosis is a reality, it is happening. Over medicalization is a reality, it is happening. Not all treatments are necessary, and we have to know what is necessary for us, and we should look for answers to the problem that we have rather than going for what is available. So thank you very much for watching, thank you very much for sharing in this life, and thank you for continuing, and I encourage you to subscribe to the Overall Health channel so that you may continue getting more insights, and also remember to hit the bell so that when there is new content you are notified so that you don't miss out. Remember also to share your comments, your concerns, and any topics that you think we might need to discuss in these live discussions so that we share with you. So remember, our live sessions are always on Tuesday at 8:30 a.m. Please join us as we look into the next topic next week on Tuesday. Thank you for watching.